would like to understand this Alzheimer's disease. So today I would like to give an overview about what are the causes of this disease, symptoms of this disease, how can we prevent this disease, and how can we treat the disease. So, coming to the topic itself, so Alzheimer's disease is celebrated, or Alzheimer's disease is named after the identifier Alois Alzheimer, who identified on his patient Augustus. She is an old patient who used to forget everything, and she used to develop psychiatric behavior. So he, after treating for many years and after biopsy, he found that there are some material which is deposited in the brain which is causing this particular disease. So he is the pioneer or who came let us know about this Alzheimer's dementia or disease. So coming to this overview about Alzheimer's disease, it is a progressive neurological disorder that causes brain to shrink or atrophy and brain cells to die. Alzheimer's disease is the most common cause of dementia, a continuous decline in thinking, behavioral, social skills that affects a person's ability to function independently. So any dementia can have a decline in thinking, behavioral and social skill, and affects the personal ability to function independently. In this, when there is a memory predominant disease causing all this, it is more likely to be Alzheimer's dementia. Approximately 5.8 million people in India aged 65 and older live with Alzheimer's disease. Of those, 80% are 75 years are old. Out of approximately 50 million people worldwide with dementia, between 60 and 70% are estimated to have Alzheimer's disease. What are these earlier signs of this disease? They include forgetting recent events and conversations. As disease progresses, persons with this disease will develop severe memory impairment and lose the ability to carry out everyday tasks. So, the memory loss is the main key symptom of the Alzheimer's disease. Early signs or symptoms include difficult remembering events or conversations. As the disease progresses, memory impairments worsen and other symptoms develop. At first, a person with Alzheimer's disease may be aware of having difficult remembering things and organizing thoughts. But it is the family member or the friend who will likely identify this first and bring to the notice of the family members or the other family members or to the doctor how the symptoms are worsening. Everyone has occasional memory lapses, but the memory loss associated with the Alzheimer's disease, they persist and worsen, affecting the ability of the function to work at home or at their workplace. The common symptoms of people with Alzheimer's are they make repeat statements, questions over and over, forget conversations, appointments, events, and do not remember them later. Routinely misplace possessions, often putting them in illogical locations. Get lost in familiar places. Eventually forget the names of the family members and everyday objects. Have trouble finding with the right words to identify the objects, express their thoughts, or take part in the conversations. Thinking and reasoning are also involved, and they could not have their previous intellectual ability of giving answers to the questions asked. The Alzheimer's disease causes difficulty concentrating and thinking, especially about abstract concepts such as numbers. So after these common symptoms which are present, the next thing which they find difficulty is multitasking. It becomes especially difficult, and it is also challenging to manage finances, balance checkbooks, pay bills on time. Eventually, a person with Alzheimer's will be unable to recognize and deal with the numbers. The next, making judgments and decisions. Alzheimer's causes a decline in the ability to make reasonable decisions and judgments in everyday situations. For example, a person may make poor or uncharacteristic choices in the social interactions or wear clothes that are inappropriate for the weather. Like in rainy season, they don't they don't take that umbrella or they don't take a raincoat, and in summers they wear blankets and jerkins, which is inappropriate to that weather. If you ask, they say that they deny the concept that the outside temperature is very cold and they don't actually remember what they are doing. It may be more difficult to respond effectively to everyday problems such as food burning on the stove and unexpected driving situations. So, coming to next symptom, it is the planning. Planning is a very important feature on our day-to-day work. In Alzheimer's disease, the routine sequential steps like planning for cooking a meal, playing a favorite game, becomes a struggle as the disease progresses. Eventually, people with advanced Alzheimer's disease often forget how to perform the small basic tasks like bathing and dressing. Finally, when the advanced stage of the Alzheimer's disease comes, there is a lot of change in the personality and behavior. The brain changes that occurs in the Alzheimer's disease, they affect the mood and also the behavior. What types of psychological abnormalities can be observed is that depression, apathy, being very lonely, and social withdrawal, mood swings, like sometimes being very elated mode, sometimes very calm mode, and not coming out of the rooms, distrust in the others, irritability, aggressiveness, and changes in the sleeping habits. Wandering, loss of inhibitions, delusions, believing something has been stolen are very common symptoms which are observed in the advanced Alzheimer's disease. In Although we say that all of the memory related, planning related, multitasking related have been lost, there will be even some preserved tasks which can be skills which are still left out. And they're mainly like reading, listening to books, telling stories, reminiscing, singing, listening to music, dancing, drawing, and doing crafts. So these are a long learned skills which have been present since their childhood. So these are preserved to the end of their last, even though they forget their own names and also they forget themselves, but these will be remembered for long. The main reason for all these things is that these skills are being controlled by the brain affected later in the course of the disease. So generally we say that medial temporal lobe, the central part of the brain, the temporal lobe, the most medial part is the one which has hippocampus and it is responsible for the recent memories. So those are the areas first involved. So the recent memories are the ones which are earliest lost. But in the lateral temporal lobe, we have all these skills. So when this is the last part of the brain which gets atrophied, so these are very much preserved until the last advanced stage of the disease until they become bedridden. So after discussing about what are the various symptoms of Alzheimer's disease, why is it caused? So the next we can discuss about the causes, but the exact cause of Alzheimer's disease is still not fully understood. At the basic level, there are some brain proteins which fail to function normally, which disrupt the work of the brain cells, the neurons, and they trigger a series of toxic events. Neurons are damaged, lose connections to each other, and they eventually die. Scientists believe that for most people, Alzheimer's disease is caused by a combination of genetic, lifestyle, and environmental factors that affect the brain over the time. Less than 1% of the time, Alzheimer's is caused by specific genetic changes that virtually guarantee a person will develop the disease. These rare occurrences usually result in disease onset in the middle age. So the damage often starts in the region of the brain that controls memory, as already I have explained, but the process begins year before the first of the symptoms. So the presentation could be just 6 months, but the damage within the brain has been started some years back. The loss of neurons spread in somewhat predictable pattern to other regions of the brain. By the late stage of the disease, the completely brain has shrunk significantly. So researchers have tried doing autopsies and doing the biopsies of the brain and to find out what is the reason for the cause of this disease. And they have found two important protein deposits within the neurons. Out of this, they are called plaques and tau proteins. What are these plaques? Plaques is a beta amyloid fragment of a large protein. When these fragments cluster together, they appear to have a toxic effect on neurons and they disrupt the cell to cell communication. These clusters form larger deposits called amyloid plaques, which also include other cellular debris. The other is tangles or the tau proteins. Tau proteins play an important role in the neuron's internal support and the transport system to carry nutrients and other essential materials. In Alzheimer's disease, the tau proteins shape, change, and organize themselves into structures called neurofibrillary tangles. These tangles disrupt the transport system and they become toxic to the cells. So after learning about how the Alzheimer's disease is caused and a few mechanisms with the reason for Alzheimer's disease, we will see what are the risk factors which can accelerate the disease or cause the disease. So the most important factor in a dementia is age. So is the same with Alzheimer's dementia. So in this statement making, I would like to give a clarity that increasing age is greatest known risk factors for Alzheimer's disease. Alzheimer's is not a part of normal aging, but as you grow older, the likelihood of developing Alzheimer's disease increases. It means that once you age, you don't get Alzheimer's disease. But an older age group is the one which is more common for Alzheimer's dementia, and the other can be family history and genetics. The risk of developing Alzheimer's is somewhat higher if a first degree relative, parent, or a sibling has the disease. Most genetic mechanisms of Alzheimer's among the families remain largely unexplained, and the genetic factors are likely complex. One better understood genetic factor is ApoE, called as apolipoprotein E gene. A variation of this gene, ApoE small e4, increases the risk of Alzheimer's disease. Approximately 25% to 30% of the population carries an ApoE E4 allele, but not everyone with this variation of the gene develops the disease. Next, patients with Down syndrome, they have a trisomy 21, chromosome 21 anomaly. So, three copies of the gene are the protein that lead to a creation of the beta amyloid. This is also one of the reasons that the patients of Down syndrome developing Alzheimer's dementia and they having the beta amyloid deposition in their brain has confirmed that the researchers, the beta amyloid protein is the major cause for the progression of the disease. And the signs and symptoms of the Alzheimer's dementia is found to be 10 to 20 years earlier presentation in Down syndrome than the regular population. Coming to sex, both men and women are equally affected, but there are more women with the disease because they generally live longer than the men. Mild cognitive impairment. This is more important in Alzheimer's dementia. It is defined as decline in the memory or thinking skills that is greater than normal for a person's age. But the decline doesn't prevent the person from doing his activities of daily living. So people who have MCI, the mild cognitive impairment, have a significant risk of developing dementia. When the primary MCI deficit is memory, and the condition is more likely to progress to dementia, likely to Alzheimer's dementia. A diagnosis of MCI encourages a greater focus on health style life changes, developing strategy to make memory loss, and scheduling the regular doctor appointments to prevent the progression of the disease. So other small factors which can aggravate the incidence of Alzheimer's disease are head trauma, air pollution, and excessive alcohol consumption. Head trauma, several large studies have shown that people aged more than 50 years or older who had a traumatic brain injury, the risk of dementia and Alzheimer's disease has increased, and the risk increases in people with severe head injuries and also repeated head injuries. Air pollution is also found to have in population where there is more of wood dust, traffic exhaust, burning wood, and the researchers have found that these patients are prone to have earlier onset of dementia. Then excessive alcohol consumption. Excessive alcohol consumption is known to cause several brain changes, every one of us know. They show that there is increase of dementia, especially early onset dementia. It may not be Alzheimer's alone, it can be a mixed dementias as well. Next, the others are poor sleep patterns. Research has shown that poor sleep patterns such as difficulty falling asleep or staying asleep are associated with an increased risk of Alzheimer's disease. So the lifestyle and heart health. So this is one of the most important in many of the diseases like metabolic syndrome, cardiac diseases, and brain strokes. Everywhere, lifestyle, migraine, headaches. The lifestyle and the heart health is an important feature. In the same way, Alzheimer's dementia also, the lifestyle has an important role. They include modifiable factors like lack of exercise, obesity, smoking, exposure to secondhand smoke, like called passive smoking, high blood pressure, high cholesterol, poorly controlled type 2 diabetes are the various modifiable factors which can enhance the Alzheimer's dementia. Therefore, changing the lifestyle habits can alter the risk, like regular exercise, healthy low-fat diet, rich in the healthy diet in which there is low fat and more of fruits, vegetables are associated with the decreased risk of Alzheimer's dementia. The lifelong learning and social engagement. So when you try to stay alone, aloof, then there is a chance of high risk of dementia development. So it is better that you mingle with people, maintain social relations, not in a not in online social relations alone, but also in offline social relations are very much important. This will help in involvement in mental and social activities will reduce the risk. And the as it is found that low education levels, the less than a high school education appears to be an important risk factor for Alzheimer's dementia. So complications of this disease. So now we have discussed about causes and we have discussed about the risk factors. Now we will discuss about what are the various complications of an advanced Alzheimer's disease. Already we know memory is an important loss for the patient. The other can be language loss. He can unable to speak. Namings will be lost. He cannot name his relatives or the relation of his relatives will be forgotten. Impaired judgment and other cognitive changes caused by Alzheimer's can complicate the treatment for other health conditions. A person with Alzheimer's disease may not be able to communicate the pain he is experiencing, explain the symptoms of another illness, and follow a prescribed treatment plan, explain the medication side effects. As Alzheimer's disease progresses to its last stages, the brain changes begin to affect the physical functions like swallowing, balance while walking, bowel and bladder control. These effects increase the vulnerability to additional health problems like already told it, when swallowing is affected. So everything doesn't go into the stomach, it goes into the lungs, leading to aspiration pneumonia and flu in the falls with recurrent falls fractures and also head hemorrhages, malnutrition, dehydration, constipation, mouth sores, dental problems can all occur. So the important part how to deal with this is by prevention. So Alzheimer's, although is not a pure preventable conditions, however, a number of lifestyle risk factors are modifiable. They are the common for various diseases. So maintaining or modifying these lifestyle risk factors can definitely delay the onset of the disease, and even in an early onset dementia, if we find it, we can delay the progression of the disease. So, what are the various steps we need to consider while we want to prevent the disease? So, main thing is regularize exercise regularly. Eating a diet of fresh produce, healthy oils, foods low in saturated fat such as Mediterranean fat can be tried. Following treatment guidelines to manage the high blood pressure and high cholesterol and even maintaining the diabetes under control will definitely prevent the progression of the disease or the onset of the disease. And quitting the smoke and alcohol definitely helps. Studies have shown that preserved thinking skills later in the life and a reduced risk, had a reduced risk of Alzheimer's disease, and also by associating ourselves with participating in events, reading, dancing, or playing board games, playing an instrument, which requires mental and social engagement. So next, how do you diagnose Alzheimer's disease? Alzheimer's disease diagnosis is mainly by a consulting a neurologist who does various tests, physical examination, and finalizes the disease. The imaging also helps in comprehending and concording with the diagnosis of the disease. But a specific diagnostic tool like a blood test or something is still not available for Alzheimer's disease. So it is again a multimodal task in diagnosing the disease. An important part includes being able to explain the symptoms as well as the perspective from a close family member or a friend about the symptoms and how it impacts on the daily life. Additionally, a diagnosis is based on tests doctor administered to assess the memory and thinking skills. Laboratory and imaging tests can rule out potential causes or help the doctor better identify the disease causing dementia symptoms. Alzheimer's is only diagnosed with certainty only after death, after having a autopsy done. So it is definite certainty diagnosis cannot be done in a live patient. It is only after death. So various battery of tests which can be done to close down the differential diagnosis are, like I already explained, the physical and neurological examinations, lab test that where the other causes can be ruled out, like thyroid illness, B12 deficiencies, folic acid deficiencies, that can be done, and mental status and neuropsychological testing, which is done by the neurologist or in a formal doctor. These tests help to diagnose and serve as a staging point to track the progression of symptoms in the future. So the next important which helps in the diagnosis of Alzheimer's disease is brain imaging. It definitely helps. The various modalities of imaging has been newly introduced to definitely try to localize the disease by involvement of the particular brain material which has been involved, brain location which has been involved. Images of the brain are now used to pinpoint visible abnormalities related to conditions other than Alzheimer's disease, such as stroke, trauma, and tumors that may cause cognitive change. So, the memory disturbances in an acute stage may not always be a symptom of Alzheimer's dementia. Sometimes a tumor located, sometimes an infarct located, sometimes an old head trauma which has formed a gliosis can also start to have an acute memory loss in the patients. So when coming to the imaging, what types of imaging can be used is magnetic resonance imaging and computed tomography, the CT scan. MRI uses radio waves and short magnetic fields. It is not only used for diagnosing the dementia, but to rule out other causes of dementias. Next, imaging of the disease in the latest forms are from PET scans, the positron emission tomography. During the PET scan, we give a low-level radio tracer that is injected to the blood in a particular feature of the brain, and the PET imaging we include depending on the what isotope has been used. When we use a fluorodeoxyglucose PET, it shows areas of brain in which nutrients are poorly metabolized, identifying the patterns of degeneration, areas of low metabolism, distinguish the Alzheimer's dementia from other types of dementia. And amyloid PET imaging is a very recent new technique where we can measure the burden of the amyloid deposits in the brain. This imaging is primarily used in research but may be used if a person has unusual or very early onset of dementia symptoms. Tau PET imaging is the other imaging where we measure the neurofibrillary tangles as previously explained. In special circumstances as rapidly progressive dementia, dementia with atypical features or early onset dementias, other tests may be used to measure abnormal beta amyloid and tau in the CS. So what are the future diagnostic tests which are being developed in the research? They have tried to develop tests based on biological signs of the disease process in the brain. They include a blood test for plasma A beta, which is currently available and recently received certification in US by the Centers of the Medicare and Medicaid Services to allow distribution in the market. The genetic testing generally isn't recommended for a routine Alzheimer's disease diagnosis. But the exception is the people who have a family history of early onset Alzheimer's disease, meeting a genetic counselor and if advised can also undergo a genetic testing where the ApoE4LL can be estimated. But as I previously told, 25 to 30% of the people may not develop the disease even though it is positive. So the final, how do we treat the patient? Treating is again a multimodality. As we told from starting, the loss of symptoms is a multimodal way. The diagnosing of the symptoms is multimodal way. The cause of the disease is a multimodal way, and the treatment is also a multimodal way. It is both medical and non-medical are involved in the treatment of the patient. Currently, Alzheimer's can medications can help for a time with memory symptoms and other cognitive changes. Two types of drugs are currently used to treat the cognitive symptoms. One is cholinesterase inhibitors. They help in what do you say, the first medications which were identified and tried, and most have modest improvement in the symptoms. They are commonly prescribed are donepezil, galantamine, and rivastigmine. The main side effects of these drugs are diarrhea, nausea, loss of appetite, and sleep disturbances. In people with certain heart disorders, they can have cardiac dysarrhythmias. So the second group of drug which is used is memantine or namenda. It is helpful for it is another brain cell connection network works over there and slows the progression of the symptoms with moderate to severe Alzheimer's disease. It's sometimes used in combination with the cholinesterase inhibitor. The rare side effects could be dizziness and confusion. So the FDA has again come down with a monoclonal antibody, the adaponimab, the aduan, for the treatment of certain cases of Alzheimer's dementia. This is the latest treatment which is approved in 2021 June by the FDA. The first drug to by the United States to treat it. They approved in the country. This is the specific drug which has been identified. And even FDA has approved certain antidepressant drugs because of the associated psychological symptoms which can be seen in these patients. So these are the drugs or the medical where we have to where it can be used to treat the patients. So the other way is the non-medical thing, which is also equally important. The creating a very safe and environmental supportive thing around him is very much important. Adapting the living situation to the needs of a person with Alzheimer's disease is an important part of any treatment plan. For someone with Alzheimer's, establishing and strengthening routine habits and minimizing the demanding tasks can make life much easier. So, what are the steps we can take for the well-being of a person and continuability of the function? So, there are certain steps given so that you can ease the life of the Alzheimer's disease patient. Like always keep the keys, wallets, mobile phones, and the other valuable places in the same place at the home, and so that they will not become lost. Next, keep the medications in a very secure location. Give a daily checklist so that he has taken the medications and he has done his work according to the checklist. Arrange for the finances to be automatic payment and an automatic deposit, which could help him. Do not forget his payrolls. Have the person carry a mobile phone with location capabilities so that a caregiver can track his location if he is lost. Install alarm sensors on the doors and the windows so that they don't get false and immediately they can prevent the head injuries. Make sure that you make regular appointments on the same day at the same time as much as possible. Remove excessive furniture and sharp items nearby his rooms. Install standing handrails on the stairways. Reduce the number of mirrors. This is also very important because at the end stage disease, they try to forget themselves. So they become very bizarre and they become very furious after seeing them in the mirror. So people with Alzheimer's may find images in mirrors, they're confusing and also they become frightening. Keep photographs and other meaningful objects around the house. And finally, when they are going out, please make a medical badge and put it in his pocket or around his neck so that even if he is lost, he will be returned back safely by some bystanders. So, even alternative medicine has also been tried in preventing rather than telling preventing in decreasing the progression of the disease. So delaying the progression of the disease, like herbal remedies, vitamins, other supplements can also be used, like vitamin E, omega-3 fatty acids, curcumin, ginkgo biloba, and melatonin. In which melatonin is like a supplemental hormone which helps us to regulate the sleep-wake cycle. So research found that they worsen the mood, but actually the memory has been become better. Next is lifestyle and home remedies. Regular exercise, I have already told before, is an important part of a treatment plan. Activities such as daily walk can help improve the mood, maintain the health of the joints, the muscles, and the heart. They also help promote restful sleep and prevent constipation, and it is beneficial for the care partner side too. Nutrition. Most of the Maldives they forget to eat or they eat more. So when this is there, they may need to either they become obese or they become lean or they become dehydrated. So a proper planning and the checklist of the food has to be given to them, and which includes fresh vegetables, low fat and low unsaturated fats. Food should be better given to the Alzheimer's disease patients. So water and the other fruit juices can be given, and high calorie healthy shakes and smoothies can be given. Engagement into the social activities is very much important, and making them feel enjoyable and making their life meaningful by doing activities like listening to the music, dancing, reading, listening to books, gardening, crafts, and the social events at senior or memory care centers, planned activities with children, coping and support, and mingling with other Alzheimer's disease patients where they have different types of emotions can make them feel better, and they can have their life meaningful and enjoyable. A calm and stable home environment can also reduce the behavioral problems, new situations, noises, then large groups of people being rushed or pressed to remember or being asked to do complicated tasks can definitely land them into anxiety. As a person with Alzheimer's becomes upset, the ability to think clearly declines and even more. So the final part of this topic is, so Alzheimer's dementia patients, so initially they can be easily managed, but in an advanced Alzheimer's disease patients, it is the caregivers which is very important for their continuation of their happy life. So caregivers, caring is also very important. So this is the last few lines I would like to tell before I conclude, that caring of the caregiver is very much important because it is physically and emotionally demanding. Feelings of anger and guilt and discouragement, worry, grief, and social isolation are very common for the caregiver. So caregiving can even take a toll on the caregiver's health. So paying attention to the own needs and well-being is the most important thing you can do for the suggestion to the caregiver and for the person with the Alzheimer's disease. So I think I would have covered in detail about the history, causes, the diagnosis, the imaging part, treatment, regular treatment, and recent advances, and how do we prevent this and make the patient lead a very healthy and enjoyable, careful life. Thank you. Yeah, complete.